afternoon, everyone. Thank you so much for logging in and joining us today for this important conversation. My name is Kim Stronero. I'm a community outreach specialist at the Alliance, as well as the director of Camp Trek. And I'm here today with Susanna Combs, who is the manager of the TBI Fund, and I will hand it over to her to explain a little bit more about what she does.
Hi, thanks, Kim. Thanks. I'm so happy to be here. Again, I am Susanna Combs. I am the program manager for the Traumatic Brain Injury Fund, or the TBI Fund. I am happy to be representing the New Jersey Division of Disability Services. We are housed within the New Jersey Department of Human Services. Just to orient some of our audience to DDS, the Division of Disability Services, we like our acronyms at the state. DDS manages several programs that some of you may have heard of. Of course, there's the TBI Fund. We also have our famous Information and Referral Assistance Services, where we have nationally certified information and assistance specialists that deal with thousands of phone calls a year. We also administer the Personal Assistance Services Program, or PASP, where folks with physical disabilities can get personal care assistance. We have the Inclusive Healthy Grants Program. We also help children with the enrollment process for MLTSS, that's Managed Long-Term Supports and Services. We have a small program, the Disability Health and Wellness Program. We do some work with women survivors of domestic violence, women with disabilities, excuse me. And then we also manage the NJ Able Accounts Program here in New Jersey, among a smattering of other things that we do. Those are the big ones that we're known for. So again, I'm happy to be here today. Thank you very much.
Great, thanks so much. I appreciate you providing that background, Susanna. And today we'll be talking about the TBI Fund and really focusing on how to understand the TBI Fund and how to navigate that wonderful program. And so jumping right in, I'll first ask, what is the TBI Fund?
Okay, thanks for asking. So the TBI Fund is a way for New Jersey residents who have survived a traumatic brain injury to receive TBI-related supports and services so that they can continue to live independently in their communities. The TBI Fund fills the gaps when insurance or personal resources or other public programming is unavailable. The TBI Fund is funded through a 50-cent surcharge on your motor vehicle registration. So every time you register your motor vehicle, 50 cents comes to the TBI Fund. About a third of our funding does go to the Brain Injury Alliance for outreach, education, prevention. We're very happy to be partnering with BINJ in this important work. We have currently serving about 350 beneficiaries through the fund, and we were established by statute, so a law was signed establishing the TBI Fund back in 2002.
Great, thank you so much. Well, I appreciate that basic information about what the TBI Fund is as a program, and of course we appreciate the ongoing partnership and working with you as well. And so next question I have are, what are the eligibility criteria for the TBI Fund?
Okay, so as I mentioned, you have to be a New Jersey resident. We do have a 90-day look back, which means that you need to live in New Jersey for about 90 days before you can apply for the fund. You have to be an individual who survived a traumatic brain injury, have a medically diagnosed traumatic brain injury. We do serve individuals of all ages across the lifespan. The other major eligibility criteria is that you cannot have more than $100,000 in assets to be eligible for the fund.
Great. Well, thank you so much for that information.
Sure.
And just a lead-up question, where do referrals usually come from for the TBI Fund, and how can someone apply if they're interested in this program?
Sure. So we get a lot of our referrals from our information and referral unit. We also get a significant number of referrals from BINJ's CARES program. We get referrals from hospitals and rehab centers, and then of course from word of mouth. Community talks. Everybody talks to each other and talks about the fund. So how can folks apply? Within the last year, we have streamlined our application process. We have created an online application that is available on our website. I do have website addresses and telephone numbers that I can give you guys. I can read them to you. Maybe we could put them somewhere in
Sure.
some kind of chat or something as well, so that you can access them even after we're done talking.
Absolutely.
So folks can go to our website, and the application, there's a link to access the application right there. We also have on the website a sample of the application, so every prompt filled out, so that you can have an idea of, well, what's supposed to go in this prompt, how am I supposed to answer this question. We have a step-by-step written out guide that even goes through the prompts. Once you click this prompt, another prompt will pop up. This is the information you put in that prompt. So it really walks you step by step through the application. And then finally, we also have an FAQ, a frequently asked questions document, that we continually update as we get feedback from folks going through the process. We do also, of course, offer the application in alternative format. If that is something that someone needs, they can reach out to our office. Our telephone number, we have a toll-free number. We also have a dedicated email address just for application questions and concerns. So we have a bunch of different ways that you can reach out to us to ask for an alternate format of the application. Yeah.
Great. Well, that's really useful information,
Sure.
and I'm sure that we can put some of that in the video description afterwards as well, so that you all have that information, both the important phone numbers and the website links and the application links and all of that, and who they
Thank
can
you.
reach out to help them with the application if there are questions or concerns, or if someone is struggling to complete it. So thank you so much. And I did see we had a question about how does someone reach out and get some assistance with completing the application. So that will be in the comments as well, and Susanna did cover that in this past question. So another question that I had was, what does the review process look like? So when someone does apply, what does that review process look like?
Sure. So before we go into the review part, I do just want to mention, in terms of the application, it is what I call a two-step application process, right? So there is the initial application for the applicant, the individual, to fill out, where you're going to put some demographic information. You're going to talk about your New Jersey residency. You're going to talk about your financial eligibility. And then the second step of the process is completed by your medical provider, any medical provider of your choosing, of course, hopefully somebody that you are working with currently or have recently in the past. But then the medical provider then provides that verification of the traumatic brain injury, the medical documentation that we need to verify that part of the eligibility. So once all of that is completed, it does come to our office, where we review it for completion, making sure all the eligibility criteria has been met. If we get everything we need right from the beginning, it takes a few weeks maybe to review and determine, make an eligibility determination. I will say that at times we do need to request additional information, and we do have a process established for that, where we reach out to folks. We're pretty specific in the information that we need, and in a way for folks to then provide that additional information.
Great. Well, thank you so much. And that was really helpful information as well. And so moving forward, what happens after you're approved? So like you said, that if all the documentation is in place, you're approved, what happens after that?
So folks that have been determined to be eligible are then referred and assigned to one of our regional case managers. The TBI fund, of course, provides supports and services to every corner of the state. We have case managers representing every region or area of the state. So an individual would be connected with a case manager.
Mm-hmm.
The case manager would then reach out to the individual and schedule and conduct an in-home visit,
Okay.
where the case manager then talks to the individual what are your needs? What are your goals? What are you looking for from the fund? What are you looking to accomplish in the next 12 months, 5 years? Those kinds of conversations to try to determine how can the fund help you? What kind of services might we be able to request funding for from the fund? And so after that conversation, and based on that conversation, the case manager then drafts a funding request. And this is a brief document where the case manager kind of highlights some of the things that maybe you said to him or her about your needs, about your challenges, about your goals, and requests funding for that particular support or service from the Traumatic Brain Injury Fund Review Committee. We do have an external review committee made up of volunteers. We have folks that have survived TBI on the review committee, family members of folks with TBI on the review committee. We have clinicians, professionals. We do have a couple of vacancies right now in the review committee, but all of this is determined in the statute that the review committee is supposed to have all these folks on there. The review committee meets monthly and will consider all of the funding requests at that time. And then they make the authorization, or sometimes they ask for more information, and rarely, but sometimes it's something that they feel they can't fund for various reasons. So the review committee, let's say they say yes to your funding request. At that point, your case manager gets involved again and facilitates that service. Sets you up as the person receiving that service to begin that service, to start receiving that support and service.
Okay, great. That's fantastic information. And so, what are some eligible services and supports?
Excellent
what is covered?
Question. Excellent question. So the TBI fund has 30 categories of eligible supports and services. So we do have a lot of flexibility, a lot of possibility for folks. Some examples, I'm not going to go through the list, but some examples are personal care assistance, home and or vehicle modifications, companion care, assistive technology evaluations, and then potentially requesting equipment that you might need, durable medical equipment. We have a couple of programs. One of them is called Life Skills Training, where, and another one's Household Management, where you work with staff who come into your home and or go with you out into the community based on what you've identified your needs are, and help support you. Maybe you need some support when you do your banking or when you do your grocery shopping. You can have your life skills trainer come with you and provide that kind of support for you. I do also want to add that eligible folks, or we call them beneficiaries, once you become eligible for the TBI fund, you are eligible to request up to $15,000 annually in supports and services, and up to $100,000 over the course of your lifetime. I also want to add that your funding request, if authorized, is good for up to 12 months. So each funding request can be authorized up to 12 months, and then after that, you would have to then request, put in another funding request. Let's say you have a service that you want to continue, the next year or over a couple of years. You do each year have to submit a funding request anew. It is considered by the review committee and hopefully authorized. But the funding requests are not guaranteed, and they don't just roll over from year to year.
Okay, great. That all makes sense. And so what if I have insurance? So what if someone has insurance, but maybe the service is covered or is not covered? How does that usually go?
Yeah, so that's a very important question. As I did mention right in the beginning of our time together, the TBI fund is there to fill the gaps. So we're identified as a payer of last resort. And what that means is that if you have health insurance, some other kind of entitlement or other governmental program that you're on or eligible for, you have to use those supports and services first. And if, let's say again, I like to use the example of physical therapy. If you're a person that has some good health insurance and you need physical therapy, you're going to be directed to your health insurance to get that physical therapy that you need. If you don't have any health insurance, or your health insurance doesn't cover something like physical therapy, that's something that you can then come to the fund and request.
Okay. Okay, great. No, that makes perfect sense.
Yeah.
And
if I could really
yeah,
fast,
sure,
so I kind of
absolutely,
skipped
yeah.
over something that I want to go back to really fast. So the fund does not provide any direct supports and services, right? So a beneficiary requests funding for, again, let's say physical therapy. The review committee authorizes that funding. A beneficiary has the choice to use one of our currently already authorized physical therapy vendors.
Okay.
To provide that service for them. But they are not necessarily limited to those vendors. Let's say my neighbor down the street used this really great physical therapist. I'm interested in using them. We, the TBI office, can then work with that vendor, and if the vendor is willing to onboard with us and become an authorized vendor, then they can, of course, then provide that service. So again, there's a lot of flexibility and a lot of control when it comes to the TBI fund. And so when I was saying before how the review committee authorizes the service and then the case manager facilitates that service, the case manager then goes to that authorized vendor that you already, put in your funding request, that you talked to your case manager about and said, yes, I would like to use them. And they initiate the service. They say, okay, vendor, you're clear to provide the service. We, of course, have paperwork that we send as well, but essentially that's what happens. The case manager says, okay, you're clear to provide the service. And then you as the beneficiary can, work directly with the vendor on scheduling what days are best for you, what time of day is best for you, what exactly the services that you're looking for from them.
Okay, that's wonderful, and I think that flexibility is so key, especially as you mentioned, if there's a vendor that's not authorized yet, but someone would like to see them, that there's a process to go through for that. So,
Yes.
so that's really valuable information. And so you mentioned payer of last resort, and you explained that a little bit, but can you just reiterate kind of what that means?
Yeah, sure. So like I said, if your health insurance covers physical therapy, or whatever service that you're looking to get from the fund, you will be directed and encouraged to use that resource. And part of the reason is, and it's a very important reason, again, the TBI fund is not an insurance, we're not an insurance. You're not guaranteed to get that money. Or to get that funding. So if you need your physical therapy and your health insurance is going to cover that, that really is the safest, best bet for you, because at any time your funding request could be denied from the fund. I mean, we don't try to do that, certainly, but that could happen. We're a very small funded program. We have very limited amount of dollars that we do have to stretch over the entire state. So that is really the primary reason why we are the payer of last resort. When you cannot get it from somewhere else, come and talk to us.
Great, thank you so much for clarifying that. I think that's really important to keep in mind. And so someone had asked if they reside in a residential group home, do they have, if they reside in a residential home, their CCP, do they have access to these funds?
Okay, so I'm not sure what CCP means, but we don't have really any kind of limitations in terms of where you're living. If you are in an acute hospital setting, we're not going to cover any services, while you're there. But you certainly can come to us to explore, what might be covered, depending on your residential situation. If wherever you're living provides physical therapy as part of the payment to live there, well, then the TBI fund is likely not going to cover that for you if that's the service you're looking for. But what doesn't the residential program cover that you are looking, that you're looking to explore, then you can certainly come to us and we could, look at that.
Great, thank you so much for that response. And then if someone is not quite able to determine the specific services that they need due to symptoms of brain injury, cognitive symptoms, where can they go for help to determine what services they might benefit from that they might need?
Sure. So like I said, we do have case managers that are going to have those conversations with you. And again, they're going to have those conversations in your home because they're not judging you, right? But they're looking around and they're trying to see, well, do I think, Susanna has a lot of support in her house, or maybe she really doesn't have anybody that she relies on. I think maybe she might benefit from something. And so that case manager might suggest it to you while you're in the home, and you would explore that. Certainly, we do not necessarily, I guess we recommend services, but again, the choice is completely up to the beneficiary, whether they want to even have the conversation about that particular service, or if they're really interested in exploring that and potentially submitting a funding request for that. So we do have that support. And of course, I know the CARES program also helps out a lot to talk to folks about, various, exploring various needs.
Absolutely. Yep. So I saw that if you look at in the chat, the Brain Injury Alliance in New Jersey, we had submitted some information about our helpline and CARES program and how you can reach out to us for those programs. And then, of course, there's some information about how to get in touch with the TBI fund as well. So if anyone's interested in looking more into that, that's all in the chat. And then, does the fund provide financial assistance? Was another question.
Yeah. So we do not, and that kind of brings up another point. So we do not provide any financial assistance. Again, you request funding from the fund. The fund then pays the vendor directly, which is very helpful for a lot of our beneficiaries, right? Because you don't have to worry about the billing aspect of it. You make the appointment, you get the support and service that you need, and then that vendor bills the state directly, and we pay them directly. And this is also very important because then, we're not going to reimburse, we're not going to give you the money up front, so that doesn't mess with your income and potentially, make you ineligible for other programs that you might be on.
Absolutely.
So yeah.
Great, thank you. Yep. And does it matter when the TBI was sustained? So sometimes we get that question of, what if I sustained a TBI 20 years ago? Does it matter the time frame?
No, it does not matter the time frame nor the location where you got your TBI. The most important thing that we're looking for is, of course, the diagnosis of the TBI. And I do recognize that it can be challenging for some folks who have experienced their TBI, many years ago to get that documentation. But certainly that doesn't limit you, when or where you got your TBI.
Okay, that's wonderful. And then similarly, is there an age limit? I think you mentioned this before.
Yeah, no, there's no age limit. Any age across the lifespan, but I do want to point out that if you are a minor applying for the fund is going to look at your parents' financial eligibility to make sure the assets that your parents have. And I think it's also a good time to mention, if you are married and you are applying for the fund, we are going to look at not just your assets, but also your spouse's assets.
Okay, great. Well, this has all been really helpful. I don't see any other questions. Let me just make sure. Yeah, I'm not seeing any other questions. So I guess we can go ahead and wrap up today, but thank you so much for coming in and sharing this really valuable information with us. It really is a wonderful program. Again, there's more information in the chat, in the comments, about how to get in touch with the TBI fund, how to get support in applying for the TBI fund, and also our helpline information if you would like additional support. So again, thank you so much for joining us.
Thank you so much for having me.
Thank you everyone for joining today to get this really useful information, and I hope that everyone has a great rest of your week. Thanks so much.